The coronavirus is an umbrella term that covers a host of different viruses that cause illnesses ranging from the common cold to more severe respiratory infections like pneumonia, bronchitis, MERS, and SARS. There are different types of coronaviruses, some of which cause respiratory symptoms and others that cause gastrointestinal symptoms. By definition, coronaviruses are transmitted from animals to humans. SARS, which is very well known, came from cats in China. MERS, which is not as well known, came from camels in Saudi Arabia. The current coronavirus, the COVID-19, is currently not known as to its source. The cause of COVID-19 is yet to be known. So what is the COVID-19? It was first identified in China in December 2019, and it's a cause of many respiratory symptoms, similar to those of the common cold, such as coughing, sneezing, fever, and difficulty breathing. What are the common signs of COVID-19? The signs of infection are respiratory in nature, and they include fever, cough, and difficulty breathing. In cases where the infection is more severe, signs may include pneumonia, kidney failure, and even death. 7 tips to ensure you don't get infected by COVID-19 and also to ensure that your family and friends and coworkers don't get infected either. Well, the first is to wash your hands regularly, minimum 20 seconds with soap and water. The second is to cover your mouth and nose when you're coughing or sneezing, and make sure that you dispose of the mask or the napkins that you used whenever you cough or sneeze on them. The third way to protect yourself from COVID-19 to thoroughly cook meat and eggs. The fourth way is if you're not feeling well to stay at home. This will prevent the COVID-19 from being spread to your family and friends and coworkers. Tip number 5 is to avoid close contact with those that show symptoms of respiratory illness, such as coughing and sneezing, and keeping a minimum of 3 to 6 feet away from them. So that's 1 meter to 2 meters away from someone that is exhibiting those kind of symptoms. Tip number 6, in healthcare settings, be sure to be wearing personal protective equipment, which includes, but is not limited to, gloves, masks, eyewear protection. And tip number 7 is if you've been to China in the past 14 days, to make sure to seek medical advice. So what happened? In 2019, an outbreak in China occurred in the city of Wuhan, where a group of individuals were identified with pneumonia. The medical surveillance system implemented since the SARS outbreak in 2003 that looks for unusual events detected the presence of new coronavirus. The virus spreads through the respiratory route, i.e. through droplets, which affects coworkers and families of those affected. Those infected develop respiratory disease. How do you know you're infected with coronavirus? Diagnosis is made via PCR, which is a short term for polymerase chain reaction. It's a laboratory test that looks for the genetic fingerprints of the virus. So who's at risk and who isn't? The Public Health Agency of Canada has assessed the risk for Canadians in Canada in contracting the COVID-19 to be low. Risk of severe disease depends on a strong versus a weakened immune system. Are there treatments for COVID-19? Currently, yes, there are treatments, but there are no vaccines, so there's no cure for COVID-19. But there is treatment, and you should seek medical advice if you feel that you are exhibiting those kind of symptoms that we discussed prior. If you're wondering whether there's a risk of receiving packages from China, whether or not that's going to cause a spread of the virus, and the answer is no. The virus does not spread through packages because it doesn't live on surfaces for a long period of time. Is it possible to spread the virus if you're not exhibiting the symptoms? i.e., can you be a carrier of the virus without having those symptoms? Absolutely you can, and so we should take all the measures, all the precautionary measures, so that we can eliminate or minimize the risk of infecting other people or being infected ourselves. Okay guys, thank you so much for tuning in to this segment on coronavirus. I hope it was beneficial to you. If it was, make sure you share it to other people. And if it wasn't, give me some feedback and leave some comments in the comment section below. Thank you so much, and we'll talk to you soon.